Welcome to Route to Nursing. Hello, welcome to all. Subscribe my channel Route to Nursing. Today I am again with the common psychiatric terminologies. Delusion. What is delusion? Delusion is false belief that is not true to fact and not ordinarily accepted by other members' explanation. So it is a false belief. Delusion means a false belief. Dementia, it is a brain dysfunction characterized by gradual, progressive and chronic deterioration of intellectual function. Deterioration means decrease, means distraction of intellectual function, judgment, orientation, memory, affect or emotional stability, cognition and attention. So these all things will be deteriorating. Then delay means unconscious refusal to face thoughts, feeling, wishes, needs or reality factors that are consciously intolerable. Denial we can see in the Kubler-Ross data. We can see the first as denial. Then depersonalization means experience of unrealness, feeling of separation, loss of feeling and personal identity. So person is not existing, that is depersonalization. Derealization means the feeling that surrounding world is not real or is distorted. Means there is no surrounding world, it is fake. We are thinking like that. That is known as derealization. Then next is the desensitization. Diminished emotional responsiveness to a negative, aversive or positive stimulus after repeated exposure to it. This procedure is known as systematic desensitization. So if we having a phobia, we are exposing to that phobia repeatedly, then where fear will be going. That is known as systematic desensitization. Dissociation means the act of separating and detaching a strong emotionally charged conflict from one's consciousness. So removing the one's emotionally charged conflict from one mind is called dissociation. It is called a dissociation. Next, dysthymia. Dysthymia means a state of chronic low-level depression lasting for more than 2 years. So, it is a low-level depression that lasts for more than 2 years. Dissociated means the person is not remembering their identity, their personal identity, and they wander some place other than their home. Usually from home they will go from home. Grandiosity means a person is having exaggerated conception of his or her importance, power or identity. This means that a person believes that he is the most important person. Some narcissistic personalities having shown this delusion of grandiosity. Grief means appropriate emotional response to an external and consciously recognized loss. So when we are getting grief, we are having a loss. So that is known as grief. Hallucination, it is a false perception which is not a sensory distortion or misinterpretation but which occurs at the same time as real perception. So in hallucination there is no stimuli. The person is perceiving a false perception. So this is the main characteristic features of schizophrenia. Then hypochondriasis. Disorder characterized by preoccupation with the fear of developing a serious disease or the belief that one has a serious disease. Then next thing is the hypomania. Hypomania means distinct period of at least a few days of mild elevation of mood, sharpened and positive thinking and increased energy and activity level. So there will be a few days of mild elevated mood, sharpened and positive thinking and increased energy and activity level. Hysteria means this is characterized by many somatic symptoms body. Somatic means body that cannot be explained adequately on the basis of physical and laboratory examination. So lab data, physical assessment, we can't get nothing. But the patient is always complaining and complaining. That is known as hysteria. Ideas of reference, that mean by incorrect interpretation of incidents and external event as having a particular or special meaning of specific to a person. Next I am moving. Illusion. This is the misinterpretation of external stimuli. So here means there is a stimuli but the person is misinterpreting that stimuli. That is known as illusion. Impulsive means lack of impulse control, emotional stability and lack of impulse control. Labile means moving from one point to another point, that patient is unstable. Libido means forces by which sexual instinct is represented in the mind. Then next euthymia, normal range of mood is called euthymia. Echopraxia, it is the repetition, echo or mimicking of actions. So the difference is action observed when asked not to do so. Echolalia means repetition of echo or mimicking phrases or words heard. Ecstasy, very severe elevation of mood. Exaltation, severe elevation of mood. Elation, moderate elevation of mood. So euphoria means mild elevation of mood. So ecstasy is the very severe elevation of mood. Then mania means characterized by elevated, expansive or irritable mood. Neologism means formation of new words. So syllables may be for idiosyncratic psychological reason, combining syllables of other words. Neuroleptic malignant syndrome, this is a potentially life-threatening, characterized by muscular rigidity, rigid muscles, fever, autonomic instability, and an altered level of consciousness. These are the signs and symptoms of neuroleptic malignant syndrome. Nihilism means a type of delusion and false feeling that self, others, or the world is non-existent or coming to end. So here the patient believes that there is no world, there is no world, there is no person, other persons are not real, like that. That is known as nihilism. Next is the obsession. Obsession means irresistible thoughts or feeling that cannot be eliminated from consciousness. Irresistible means the patient can't resist the thoughts, the feeling that can be eliminated, that cannot be eliminated by logical effort associated with the anxiety. The patient is always having anxiety associated with the obsession. Paranoia means chronic, well systematized delusional state without hallucination. Perseveration is the persistent and inappropriate repetition of the same thoughts. So, repetition of the same thoughts, that is known as perseveration. Perseveration. Phobia means persistent, irrational, exaggerated, and invariably pathologic dread of a specific stimulation or situation. So, the patient is having pathological fear for a specific stimulus or situation. That is known as phobia. So, pica means persistent eating of a non-nutritive substance for at least 1 month. So, the non-nutritive may be mud, then paint, etc. Tangentiality means patient is saying something, but he will not enter the point, he will not enter the desired point, so he will go directly through the association of their thought. Waxy flexibility is a condition who can be molded into a position that is then maintained when an examiner moves the person's limb field as if they are made of wax. So waxy flexibility can be seen catatonic schizophrenia. So the patient look like a wax when her limbs or other things are removed. The position will not be changed. The position will be always maintained in that position itself. That is known as waxy flexibility. So these are about the common terminology in